Hi, I am Dr. JP Silvera from TaylorMade Health and Wellness, and I want to talk about something a patient said to me recently that I think a lot of people are quietly wondering but never actually ask. She had been in a car accident about a week before she came in. Nothing catastrophic, a rear end collision at a stoplight, but her neck had been bothering her and her lower back felt stiff in a way it never had before. She sat down across from me on that first visit, and after about 20 minutes of questions and examination, she looked at me and said, "So when do we actually do something?" I understood exactly what she meant. She came in expecting to get on a table and feel a pop and walk out feeling better. Instead, we spent the whole visit talking. Here is the honest answer I gave her, and I want to give it to you too. Adjusting a spine before you understand what is happening in that spine is not care. It is guessing, and guessing with someone's nervous system is not something I am willing to do. So let me explain what a chiropractic adjustment actually is, why the first visit looks the way it does, and what the process looks like for someone recovering from an auto injury. Because if you have been through a crash or you are thinking about coming in, you deserve to understand this before you walk through the door. A chiropractic adjustment is a controlled force applied to a specific joint to restore movement that has become restricted. That is it. When you are in a car accident, the sudden force of impact causes certain joints in your spine to lock up. They stop moving the way they are supposed to. That restriction irritates the surrounding tissue, the muscles, the ligaments, the nerves that pass through that area. The adjustment frees up that movement, and when that joint starts moving again, the irritated tissue around it has a chance to settle down. Simple concept, but the application is not one size fits all, and this is where a lot of people have misconceptions. There is more than one technique, and the right one depends entirely on the person in front of me. A manual thrust adjustment is what most people picture when they think of a chiropractor. The practitioner uses their hands to apply a quick, precise force to a joint. There is often an audible release, that popping sound. That sound is just gas escaping from the joint fluid as pressure changes. It is not bones cracking. For many mechanical problems, this works extremely well. An instrument assisted adjustment uses a small, handheld device that delivers a lighter, more targeted impulse. No big force, no twisting. This is often the right choice when an area is still acutely inflamed, or when a patient is apprehensive about manual manipulation, or when we are working with someone who is older and has more fragile tissue. Gentler does not mean less effective, it means more appropriate. Flexion distraction is a technique that uses a specialized table that moves. The practitioner guides the spine through a slow rhythmic decompression. Think less of a thrust and more of a sustained, controlled stretch. This is particularly useful for disc-related pain. For patients who have herniation or symptoms that radiate down the arm or leg, it takes pressure off the disc and gives the surrounding tissue room to breathe. So when you come in, part of what I am doing in that first visit is figuring out which of these approaches is appropriate for you and whether we are ready to start at all. Because here is something that is not talked about enough. Some situations are not appropriate for adjustment. If imaging shows a fracture, if there is severe nerve compression, if there are certain vascular conditions present, we do not adjust. We stop, we refer, we make sure you are in the right hands for what you actually need. You only find those things out by looking first. Now here's the part I really want you to hear, especially if you have been in a recent accident and you are feeling okay right now. Whiplash and soft tissue injuries from car accidents frequently do not produce their worst symptoms immediately. You can walk away from a crash feeling shaken, but basically fine, go home, go to bed, and wake up 2 or 3 days later barely able to turn your head. The inflammation has a delay. The micro tears in muscle and ligament take time to make themselves known. Feeling okay after an accident does not mean you are uninjured. It often just means the process has not fully started yet. This is why we encourage people to come in even when they feel relatively okay. Early assessment gives us a baseline, it gives us documentation, it gives us a chance to address restrictions before they become chronic. The patients who wait 6 weeks and then come in because the pain finally became unbearable are the harder cases. Not impossible, but harder.